Okay. So again, welcome to everyone in class. I'm going to go to chapters 7, 8, and 9 and just do the questions. You know, let's learn through the questions on those chapters, 7, 8, and 9. Because sometimes in the practice exams, we don't see a lot of questions there, but the questions do come on the exam a lot. So let's hit questions 7, 8, and 9. So let's launch for chapter 7 here. Okay. I'm just going to go straight to the chapter quiz. And all right. So as it is customary, we will just go around and have different people read. Okay, we'll go ahead and have everybody read. Mr. Oluwatosin, you want to read this one?
Okay. John has both a basic expense and a major medical policy. He is injured in an accident which requires several major surgeries. This quickly exhausts Don's basic expense policy. What must Don do before his major medical policy can pick up where the basic expense policy left off? A. Pay a special deductible on his major medical policy. B. Wait 6 months in order to be covered again. C. Submit written notification to his major medical insurance company. D. Nothing needs to be done. The hospital's billing staff will make the appropriate arrangements.
Okay. It's an interesting question. So which one do we think is the answer here? So what must Don do before his major medical policy can pick up where the basic expense is left out? He has exhausted his basic expense. What do we think is going to happen here?
I think D. Nothing needs to be done. The hospital billing staff will make the appropriate arrangements. Since I'm assuming that they are aware of his medical policy.
Okay. Any objections to that? Or any alternative? No objections? Let's go with D. Submit. Oh. It says pay a special deductible on his major medical policy. All right. So the assumption here is that for the major medical policy, you have to pay a deductible. Okay.
Okay.
Mr. Oluwatosin, I would have gone with your same answer, and I still would like to go with your same answer, though they probably think otherwise. And the reason why I would have gone with your same answer is that because he has a major medical policy, it will kick in. But if there's a deductible, that deductible is natural. So it is because it has kicked in that they now expect him to pay a deductible. And when he meets that deductible, then it kicks in 100%. But what they are trying to tell us here is that there's a, let me not speak too much. Let's go to the explanation and have you read it. Go ahead and read it, Mr. Oluwatosin.
Before a major medical policy pays benefits not covered under an exhausted basic medical policy, the insured must pay a corridor deductible.
Yeah, so that's what they're trying to tell us, that there's a corridor deductible that must be paid before it will kick in. So, but I still I still think D is the better answer. Because yeah, they will make the appropriate arrangements, which might include paying the deductible. You know? So, but for the purpose of the exam, we just have to remember that we have to choose the one that is specific, which says they have to pay a corridor deductible.
Good evening, sir. Good evening, everyone. I was going to ask that, is that deductible applicable in all circumstances? Like, because there are some insurance that you have and you may not even have to pay any deductible.
Correct, but good evening, Ms. Ibukun Noloa. Yes. I usually get a little bit of a tongue tie, but that's okay. I'm getting more used to it. To your lovely name. Yeah, there are some policies you don't have to pay any deductible, but this one is specifically telling us that it's a major medical insurance policy. So there are certain elements of a major medical insurance policy, which is that you have to pay a deductible. And you're right, some you don't have to pay a deductible, some you have an elimination period. Yeah. So, but for this one, what we are learning is that there's a corridor, you know, a corridor deductible which has to be paid before the policy will kick in. Now, they are not telling us that the policy will kick in 100%. They are not telling us that it's going to kick in 80-20, 90-10. They are not telling us. They are just saying that they have to pay that corridor. Then after that corridor, the policy is going to kick in. So, all right. And that's why I wanted us to come to these questions, because there are a lot of, you know, schemes and tricks in there. Miss Lola, can you read this one for us? Welcome to class, Miss Lola.
Good evening, sir. Good evening, everyone.
Good evening.
Vision plans will pay for all of the following services, except A, pediatric vision care, eye surgeries, one pair of glasses, and eye examination.
All right. So, and thank you for reading that. When we look at these four answers, process of elimination, there are two that we can easily eliminate.
One pair of glasses and eye examination.
Excellent. We eliminate those two. Those are things that we expect a vision plan to cover. Which brings us now to two of the options to see if
I think it's B. B will be under major medical.
Okay.
I agree too.
Yeah.
All right. Let's go there and see.
I'm thinking pediatric vision care will be covered under. Okay. Oh, sorry. That's if it has a medical.
And Miss Geraldine was very right, and you guys concurred right as well. So vision plans are limited benefit plans, so they will not cover surgeries. Okay. They will not cover surgeries. That we learn. Next one. At least we've helped recover ourselves. Now we are 50% on the pass. So, Ms. Geraldine, you want to read this one?
Yeah. Which of the following best describe the first dollar coverage principle in basic medical insurance? A, the insured is not required to pay a deductible. B, deductible and co-insurance are taxed first. C, the insurer covers the first claim on the policy. D, the insured must pay a deductible. The answer is A. First dollar coverage means no deductible, if I'm right.
All right. So, any objections? Any thoughts to the contrary? Any thoughts to the contrary? What does it mean to have first dollar coverage? It's a first dollar coverage in health insurance refers to the type of plan where the insurance companies pays all the healthcare costs from the very first dollar without any deductible or copay.
And A is elsewhere.
Ms. Geraldine, you were right on target. You were on it like white on rice.
Mm.
And that's correct. Ms. Geraldine, you want to read the explanation?
Sure. The three basic type of coverage, hospital, surgical, and medical, are often referred to as the first dollar coverage because they usually do not require the insured to pay a deductible.
All right. So we have to really pay attention to what Ms. Geraldine said, that for first dollar coverage, it pays for all healthcare costs from the very first dollar without any copay or deductible. We understand that. We'll ask this question in the exam. I'm loving this because now we are 66% on the pass. We are improving. Ms. Ebukon Noloa, can you read this one?
Yes. Most policies will pay the accidental death benefit as long as the death is caused by the accident and occurs within A, 90 days, B, 120 days, C, 60 days, and D, 30 days.
Okay. Which one do we think is the answer here?
I think you've come across this question before.
I don't know.
It's a very important question to know for the exam. There's an 80% chance it will come in the exam. Most benefits will pay the accidental death benefit as long as the death is caused by accident and occurs within, which means if you have an accident, if you're in a coma in a hospital, I don't know if it's 60 days, I don't know if it's 120 days, I don't know if it's 90 days, but if you die within those number of days, you're considered to have died as a result of that accident. If it goes past those number of days, then your death is not attributable to that accident. Isn't it crazy?
Wow.
But that's the law. And also, this has a lot of impact when it comes to how you can charge somebody in a death. It's not just about insurance policies or coverage. Generally, in law, if you are injured in an accident and say you hit somebody and that person is injured in an accident, if that person goes past a certain number of days in the hospital, then they cannot charge that driver for manslaughter. Isn't it crazy?
Wow.
So what is the number of days here? I think we've seen this question before.
I'm thinking 30 days. I'm not sure, but I think it.
That's a bold guess. Any other options here?
90 days.
90?
Okay, we have 90. The majority says 90.
Okay.
Ms. Lola, did you want to say something?
I already say 90 because I think I've seen this before. So.
All right.
Okay.
All right. So they take the 30 and they multiply by 3. 3 people object to 30. So the number is 90. So let's see if they're right.
Yeah.
And they're correct, you know. So let's really understand that it's 90 days. If you go past 90 days, then it's not accidental death. Which means also the impact is that if you have a policy and you have a rider, whose rider or which rider says accidental death and dismemberment, it means if you have an accident and you die within 90 days, they'll pay you double or triple what the death benefit was. But if you go past 90 days, voila. They don't have to pay you for accidental death and dismemberment because that death went beyond 90 days. Your stay in the hospital because of that accident went beyond 90 days. The law, huh? Okay. Mr. Oluwatosin, you want to read this one?
How are HMO territories typically divided? A. Geographic areas. B. Type of physician services available. C. Community rating system. D. By where the HMO can find the least expensive physicians.
Okay. This one is a low-lying fruit. This one is a low-lying fruit.
It's looking height.
This one is a low-lying fruit. How are HMO territories typically divided? Miss Geraldine, you should know this like with the back of your hand, if you are paying attention.
I want to take a wild guess.
Pardon?
I said I want to take a wild guess.
Okay.
Because I know that when they call you, the first thing they ask you that where are you living? To help you find a provider. So I'm assuming it's geographical.
Aha, Lola has given us a hint. Aha. So if they ask you where are you living, which answer here suggests that?
No, I'm assuming it's geographical.
Yeah, it's geographical.
Geographic.
Valentine, I was away. I walked away.
Okay. How are HMO territories typically divided? The affirmation is that geographic areas. That's why I say this one is a low-lying fruit. You see this in the exam, pick it and run. And run. Mr. Oluwatosin, you want to read that explanation to us?
Okay, so the HMO offers services to those living within specific geographic boundaries. For example, along county lines, persons who live within the boundaries are eligible to belong to the HMO. But if they do not live within the boundaries, they are ineligible.
Correct. And what does HMO stand for?
Health Maintenance Organization.
Yep, health maintenance organizations. Very true. Very true. All right, let's go to the next one. Do we have a welcome, Desmond? Welcome, Miss Awe, and welcome, Miss Lumakwa Abongwi. Welcome to
hello,
class.
everybody.
Hello. Yeah. Miss Awe, can you read this for us? Can you read this question for us?
In a relative value system of determining coverage for a given procedure, what term describes the total amount payable per point? A. Practical value. Where are my glasses? Jesus. Practical value. B. Translator factor. C. Relative value. D. Conversion factor.
Okay.
Think C.
Okay, relative value. Okay. They say, what term describes the total amount payable per point? This is a technical question. You think C?
Yes.
Okay. Let's see. You're right. Any objections?
The question says in a relative value system, so I guess C.
I like your sense of humor, Miss Ebuko Nolowa. All right. Oh, conversion factor.
That's what I didn't want to talk. I didn't want to say it.
I was thinking, there's no conversion. I'm like, Relative
didn't want to say it.
answer question.
Well, sometimes it's good to get it wrong, because when you get it wrong, then you know the answer, the right answer sticks really well. So, Miss.
So in order to determine the amount payable for a given procedure, the assigned point as a relative value of 200 are multiplied by conversion factor. This conversion factor represents the total amount payable per point. For example, if the conversion factor is $10 and the point value is 200, the policy will pay 2,000 for the procedure. That is 200 times 10.
Okay.
Conversion value.
That takes some math.
Factor.
Take some arithmetic. All right. Welcome, Ms. Karen, to class. Okay. Des, can you read this one?
The corridor deductible derives its name from the fact that it is applied between the basic coverage and the what? The corridor deductible derives its name from the fact that it is applied between the basic coverage. Is that a complete sentence?
Yes.
And oh, I didn't see the and there. Okay.
Major medical, we just saw this.
I was about to say we just saw it, and I'm glad I was not the only one paying attention.
Oh, well, I wasn't there. I'm not quite sure I know. Oh, major medical?
Major medical, yeah.
Major medical. Yes. Yeah. Major medical
coverage and the major medical.
Yeah.
How do we get to that?
We have policies that have what we call the basic expense coverage, and then you have the major medical coverage, which is a different policy.
Mm-hmm.
When your basic expense policy is exhausted, then your major medical will kick in. However, there's a corridor of coverage, or I mean a corridor deductible that has to be paid before your major medical kicks in.
Yes. Well, that's a really tricky question.
Correct.
That's the way they used to say that kind of question that is completely different from the way they're phrasing it now.
Correct. By the way, congratulations to Miss Vivian Efrebo Jack. She passed her exam.
Praise the Lord.
Yes.
Praise the Lord.
She walked into that exam room and said, "Who's your daddy?" And she spammed the exam and the you know what.
I like that.
Yes. So, all right. So they say the corridor deductible derives its name from the fact that it is applied between the basic coverage and the major medical coverage. Between the basic coverage and the major medical coverage. So remember that. I'm glad we're tackling these specific questions tonight. Ms. Karen, if you are there, can you read this one? Okay, Ms. Ebukun Nolowa, can you read this one?
Yes.
All right.
All of the following apply to short-term disability plans, except A benefit period of 26 weeks is most common for group plans. B, individual plans can provide benefit periods of up to 2 years. C, both group and individual plans are renewable. And D, group plans can provide benefit periods of up to 52 weeks.
Okay. All right. All of the following apply to short-term disability plans, except The benefit period of 26 weeks is most common for group plans. Individual plans can provide benefit for periods of up to 2 years. Both group and individual plans are renewable. Group plans can provide benefit periods of up to 52 weeks. 52 weeks is 1 year, right?
Mm-hmm.
Okay. So that is in contrast to one other answer that is listed. B says individual plans can provide benefit periods of up to 2 years. D says group plans can provide benefit periods for up to 52 weeks. Well, there's a difference, individual and group plans. Both group and individual plans are renewable. So which of them doesn't seem right?
Did it 2 years?
Yeah, there's something about that I'm suspect. 2 years is a very long time to call it short-term disability. 2 years is a very long time. Okay. A benefit plan of 22 weeks, 26 weeks is common for group plans. Yeah, that is true. C says both group and individual plans are renewable. That is true. So between B and D, we have to decide which is not reasonable or which is less reasonable than the other. And somebody says we should go with B. I want to stake my reputation on that.
I'm not sure.
Well, I'm staking my reputation. So you and I, if we're going down, we'll go down together.
All of us.
And we went down.
They're not renewable.
Short terms are not renewable.
Okay, short-term disability plans are not renewable. See, I'm very happy that we came to these questions here because they are testing us on things that if we don't pay attention, they might pop up in the exam and spank us with the dirty right hand, you know?
So the answer is C?
The answer is C. Both group and individual plans, they say both group and individual plans are renewable. For some reason, let's read the explanation and see. It just say short, go ahead.
Oh, it's short-term disability plans are not renewable.
Okay, so they are not renewable. Huh.
Let's look at the question again, please.
Okay. So read the question and chew on that a little bit. Let me just tell this person that I'll call them. All right, so sorry about that. I had to tell somebody. So the question says all of the following apply to short-term disability plans, except. So let's pay attention to the question to the answers that apply. A says a benefit period of 26 weeks is most common for group plans. True. B says individual plans can provide benefit periods of up to 2 years. Well, that seems to be the case, you know, of up to 2 years. That seems to be the case for individual plans, which means these are plans that you buy for yourself. So I can see how that can happen. It's your own plan that you're buying for yourself. You can provide benefit for up to 2 years. D says group plans can provide benefit periods of up to 52 weeks. That's 1 year. I didn't think short-term disability would extend for up to a year, but it's telling us that. I remember having short-term disability once. This was in 2003 when I fractured my ankle. Man, that was a long time ago. That's 22 years ago. And I had like 2 months off, paid time. You know, my ankle was fractured. I made the first flight I could and hopped on a plane and headed to Africa, to Cameroon. And they used traditional herbs to heal my ankle. And when I came back, I went to see the doctor, and the doctor was surprised that I walked in with my own 2 legs. The doctor was like, "Can you stand on your toes?" I stood on my toes. "Can you stand on your hind legs?" I did. The doctor said, "I don't believe it. Why don't you go down to the lab, do some x-rays, let me see if your ankle is really healed." I went down to the lab, did some x-rays, brought them back. He looked at the ones before the fracture, and after, my ankles were healed. He was like, "Wow." Then I looked at the doctor's thumb, and he had a fracture on his thumb. He was wearing a plaster there. And I'm like, "Doc, what happened?" He said, "I went riding a horse with my fiance in Arizona, fell off the horse and broke my ankle." Then the doctor turns to me and says, "Hey, Doc, did you bring some of that stuff back from Africa?"
They forgot that we're closer to God in Africa than they do.
I said, "Yes, I did." And he said, "Can you bring some to me? I want to use it." I said, "If you promise to use it, I'll bring it." Thank God I brought some back. So I brought it. It healed him. Every time he saw me after that, he called me Doc. Thought that was funny. But African herbs do heal. African herbs do heal. Natural herbs. The people know stuff, you know. Sorry for the digression. It took me back 22 years, 2003. And yep.
You know, many of them that got amputated here could have had their legs and their arms working if they went to Africa. Correct.
One interesting thing about that journey, I don't want to digress for too much, but that's when I went and met my wife. So I told I usually tell my wife that I was a single man enjoying life, and I did not want to get married at all. And God had to break my leg for me to come meet you. It was like the story of Jonah in the Bible, where God sent a shark to swallow Jonah so that he could go to Nineveh. You know.
Yeah.
You needed to break your leg to marry the most beautiful woman on earth, though. That's nice.
Yeah.
We thank God among me. So that's how I got married, you know. That's how I got plucked away from single life. So all right. So sorry for distracting. Miss Abongwe, since you said something, can you read this one, please?
Yes, Ni. Which of the following is true of a PPO? Is that a provider, physician, whatever?
Preferred provider organization.
Preferred organization. Okay.
Yes.
A. Claim forms are completed by members on each claim. B. Its goal is to channel patients to providers that discount services. C. The most common type of PPO is the staff model. And D. No co-pay fees are involved.
Wow, this is a tough one, and that's why I came to these questions, because I knew they were tough. You know, I knew we had to attack these tough questions because we'll meet them in the exam. So, what do you guys think?
I'm guessing B.
Yeah, I'm thinking B too.
Yes.
All right.
They do have co-pays, that we know.
Yes.
Claim forms are completed by members on each claim.
Channels
That's not
to
true.
providers that discount service.
I think B.
All right. So let me read this, okay? It's a PPO, preferred provider organization. Health plans elements include a network of contracted doctors and hospitals, the ability to pay specialists without a referral, and coverage for both in-network and out-of-network providers. Though at a higher cost. Key components also include potentially higher monthly premiums, deductibles, co-payments, and insurance which are shared costs for services you receive.
So maybe C.
You will not stand.
I didn't hear anything about the staff model in that explanation.
Yeah, that's
I didn't talk about the terms either.
they say no co-payment fees are involved. But this in the what you read, they said co-payments are involved.
These are involved, so that's not true.
When the premium is high, so they can be discounted services. And they said they move people to their physicians or something. So I don't know. To be the staff model or something. I'm not sure. C.
I think it's C.
I'm not sure.
The most common type of PPO is the staff model.
Since it's a good thing and the premium is usually high and they match the price, the cost or something.
What is staff model?
What is a staff model? We should know that.
Yeah.
I think it's C.
Let me research something.
It says health insurance. It's a health insurance plan that offers flexibility, but it's typically more expensive than an HMO.
So it's expensive too.
All right. So it is not. So staff model is out. It's not a staff model because they are saying a staff model is a type of an HMO.
Of HMO. Yeah.
Correct. So we take C out. So we take C out, we take D out because in everything we've read, we've seen co-payments.
So it's co-pay.
So we take C out, we take D out. So it's between A and B.
I think they help manage costs.
I stick with B because
All
you
right.
don't fill your own claims.
That's
Okay.
true.
Yeah, and if they say discounted services, although it's a PPO, they will encourage you to go to the ones that they want you to go to, but they don't stop you from going out of
Network.
Okay.
Yeah.
Let's see. And that was right.
Mm.
We learned. And I love how we learn or what we learn in this question because we understand the staff model is a certain type of HMO. We understand that PPOs, they might have higher premiums. We understand that the goal is to channel patients to providers that discount services. So we also understand about PPOs that they have in-network and out-of-network referrals. So through this question, we've learned a lot. All right. Let's go to the next one. Ms. Geraldine, you want to read this one for us?
Sure. How are employers' contribution to health reimbursement account treated in regards to taxation? They are excluded from all taxes. They are tax deductible. They are treated as income tax for the employer. They are taxed as a single business expense.
Okay.
Okay. Health reimbursement account, that's an SHA account. Usually they take it before taxes.
Okay.
Yeah, so they exclude all taxation.
Yeah, so I'm going with A.
Okay. So we definitely eliminate C. We definitely eliminate D. It's between A and B. Geraldine says, let's go for A. So let's go for A and then we'll learn.
Wait, hold on a minute. Let's look at that. It says, how are employers, not employee?
That's contribution.
It's how are employer contributions to health reimbursement accounts treated in regards to So we're talking about the employer
Employer, not
contributions. I think the
Oh,
answer
B.
is B.
Yes. It was employee. It would
Correct.
be an A. Yeah.
Correct. If it was employee, we'll go with A. If
That's
it's
deductible.
correct.
Mm-hmm.
And they are talking about employer contributions.
Yeah.
Yes. I agree.
The answer is always in the question, and we're correct.
Mm-hmm.
Employer contributions to HRAs are tax deductible. They could have also asked this question about HSAs. HSAs, health savings account. And well, for health savings account, it's not the employer contributing, but it's the
HHA.
employee electing to have amounts deducted from their paycheck to save in accounts that they can use to pay for medical expenses, HSAs. And those are also, then the answer there will be that it's excluded from taxation. All right. Question 11 here. I'm loving these questions. I hope you guys are learning as much as I am. I'm learning a lot. Desmond, you want to read this one for us?
Sure. Can you hear me?
Yes, we can.
Which is not a characteristic of group health insurance?
Okay.
A, the actual policy is called the master contract. B, group coverage will be converted to individual coverage if the group contract is ended. Group coverage may be converted to individual. Okay. Dependents of insured can be covered under group health insurance plans, correct? A plan is issued. A policy is issued to each insured individual. A policy is issued to each insured individual.
Again, this one is another low-lying fruit.
A certificate is issued. Is it a certificate as same thing as a policy?
No.
So you're right. So D is the answer.
The master policy is, the actual policy is called the master contract.
Correct.
To the business owner, yes.
Correct.
Policy is issued to each insured individual. I think it's a certificate that you issue to them.
Correct.
Okay.
The certificate of insurance.
Certificate of insurance is issued to them.
Yes, not a policy. They do not have a policy. The only person that has a policy is the employer.
Is the employer.
And that policy is called the master contract.
Contract, yes.
So, but if we pay attention to A, B, and C, those are all elements of a group health insurance policy. A, B, and C are all elements of a group health insurance policy. And D is the odd person out.
Is the odd person out, okay.
Correct.
Correct.
Desmond, you want to read the explanation below?
The actual policy called the master contract is issued to the group sponsor. Only the individual covered under the policy are issued certificates of insurance as proof that they are covered. The master contract, they are covered. I'm not seeing something there. In the master contract, dependents are covered under the group plan. Correct. If the group contract is terminated, insurers may convert an individual policy without having to provide proof of insurability. Correct.
Very true. Very true. Very correct. Very correct. Next question. Miss Awe, can you read this one for us?
Which of the following health insurance plans allow subscribers the ability to receive health care service from out-of-network physicians in exchange for paying higher out-of-pocket costs? A. Point of service plan, POS. B. Indemnity plan. C, preferred provider organizations, PPO. D, managed care.
Okay. Which one do we think is the answer here? Remember, we saw something about PPOs.
Let's see. C.
Okay. But just to learn something. Okay, let's learn something about the POS, point of service plans. It says a point of service or POS plan is a health insurance option that allows members to choose between in-network and out-of-network providers, but with lower costs for in-network care. POS plans share similarities with PPO and HMO plans. All right, so, but this question says, which of the following health insurance plans allows subscribers the ability to receive health care services from out-of-network physicians in exchange for paying higher out-of-pocket costs? Again, let's look at POS. It says, a point of service plan in a health insurance option that allows members to choose between in-network and out-of-network providers, but with lower costs for in-network care, which means out-of-network care will pay higher costs.
Pocket.
So which one do we think is the answer? A or C?
So out of network and point of service is probably higher then.
So let's go with A and then we'll see. Oops.
Let's C is the answer.
All right. I butchered that one.
Yep. C.
Okay.
Under a PPO subscriber may choose to receive healthcare service from out-of-network physician. However, the subscriber will be responsible for paying more of the service cost.
All right. Okay. So I mean, let's drill that down. I think I've learned something from here that for a PPO,
people will pay out of pocket.
Correct. They can choose out-of-network physicians, but they will pay a higher service cost. So which is the same thing that it talks about a POS plan. So I'm wondering what the difference is. But let's remember that for the exam, the PPO is what we select. So, all right. Lola, can you read this one for us?
Group health insurance is characterized by all of the following except A, adverse selection, B, conversion privilege, C, a master contract, D, lower administrative cost. I think it's adverse selection.
Master?
Except.
Except, I think it's A. Because B says conversion privilege. It means at the end you can go to.
I think they can convert it.
They can convert to another insurance.
The master,
and they have a
master
master
copy.
contract.
And low administration fee.
Yeah, low administration.
I think it's A.
It's A? Yeah, A is the answer.
What is adverse selection?
I'm thinking adverse selection means in a group insurance, you don't have insurability. There's nothing that they take on individual basis that whether you qualify or not.
It is made, the policy is based on the number
of people.
Yes.
Okay. So yeah, you guys are both right, but just to dig a little bit or delve a little bit deeper, adverse selection is when a company adverse selection is when a company is taking more policies or writing more policies that have bad risk. So
I have what now?
that have bad risk, which means they are writing policies for clients that are
Increased liability.
that has more liability, that are more risk. So they say group health insurance is characterized by of the following except. Well, since these are people who are employed and they are covering almost everybody, then there is no tilting towards adverse selection. So you guys are right. The answer is A. The except is A. But I just wanted to explain why we are selecting A. Any questions? And that's correct. Yeah. Lola, you want to read that explanation for us?
If the insurer issues a group health insurance policy, they must cover everyone in the group under the master contract. Group underwriting process is designed to avoid adverse selection.
Correct. Very true. Mr. Oluwatosin, you want to read this one?
The disability in policy. All of the following are considered presumptive disabilities except loss of one eye, loss of a speech, loss of 2 limbs, loss of hearing.
Okay.
Loss of 2 limbs.
All right.
I'll say A.
It's not presumptive disability.
It's loss of speech. They don't. I know that loss of speech is not familiar.
The loss, yeah, except loss of speech. I don't think that the oddball out there.
We have 3 answers. We have 3 answers.
I say loss of speech, you can't talk. Loss of 2 limbs, you can't do anything. Loss of hearing, you can't hear. Loss of 1 eye, you still have 1 eye to see.
I think the answer is C.
Well, picking, let's go. I think it's A.
I'll go with C. It's either going to be C, B, or D. Oh boy, Geraldine, you were right.
Yeah, if you think about it, everything comes in 2. When you lose your 2 arms, you can't do anything. You lose your 2 eyes, but you've lost 1, you still have 1.
Okay.
You lost your speech, you can't talk. You lost your hearing,
This is the Joro. She's using a nurse practitioner experience to win us.
I'm not a nurse, so I'm not a nurse.
Oh, I thought you are.
Okay,
I'm a pharmacist. I'm not a nurse. I'm just, I don't know.
Okay, so I think I missed something. They say except.
Except the oddball out there.
Oh, except.
So Geraldine was right. She read the question right. Except.
Lord. I didn't say
Loss
that
of 1 eye. And let me read to you guys what presumptive disability is.
Is that an ADD?
Yes. They say presumptive disability refers to a medical condition that is automatically considered disability based on a certain criteria. This means that the individual does not need to prove their disability. It is presumed based on the presence of a qualifying condition. So when you look at all of those 4, the only one that the person will need to prove that their disability is the loss of 1 eye.
Oh, right.
But loss of speech, if you cannot speak, you cannot speak. That qualified condition is already present. Loss of 2 limbs, hey, when somebody shows up without 2 limbs, nobody has to tell you that that person is disabled. Loss of hearing, if you cannot hear, that's a presumption.
How is that different from speech, though?
No.
If that's the rationale.
You see, B, C, and D are qualified for presumptive disability. A is the except.
No, that is not qualified.
Yes, because you can have 1 eye and still be able to see. Try block your 1 eye, you'll still be able to
use the other eyes to see.
Just 1 eye. Okay, that's the.
And
Yes.
As
I think
well.
somewhere
of
in the
the
reading material, it does say that if you have to if you have two organs, you have to lose both of them. So you have two. Somewhere in that material, I read it. Yeah.
Correct.
So you have to lose both eyes to be able to
Yes,
qualify for
you have to
presumption.
lose both hands. You have to lose both legs.
Now them go lose their two eyes. Not be none of us.
Amen. We
Not
cancel
any of
them.
us.
We
We
cancel
come here
that
to
in
get the
mighty
best out
name
of life. We're
Jesus.
not losing our two eyes. God forbid.
Correct. Correct. Yeah. Correct. Well, Miss Karen, if you are there, you want to read this one, 15 of 15? There's somebody there with an iPhone whose name is not written. There's somebody there with an iPhone.
Okay, I can read.
All right.
Which of the following is not true regarding basic surgical expense coverage? A. It is commonly written in conjunction with hospital expense policies. B. There is no deductible. C. Coverage is unlimited. D. Contracts include a surgical schedule.
Okay.
Is the basic surgical expense unlimited?
No.
Basic surgical expense coverage. Basic surgical expense coverage. Let's look at those four answers again and try to see if we can. Basic surgical expense policy.
If it's basic, it must be limited.
Yeah, basic is not unlimited.
That has to be limited, not unlimited.
Okay.
Include a surgical schedule.
Coverage that's not true.
Oh, okay.
That coverage is unlimited.
Yeah.
All right. So which of those do we think is the answer? First of all, which of those do we want to eliminate? Which of those do we want to eliminate?
Coverage is unlimited.
D.
We eliminate C. Coverage is unlimited. That is not true. How about B? B says there is no
D.
Okay, we eliminate D.
Why are we eliminating C? Because it's which of the following is not true?
Schedule.
Oh, they say it's not true. It's not true.
So
which of the
coverage
following is not true?
Coverage it's unlimited is not true.
It's not true.
Coverage is unlimited is not true. How about there is no deductible?
That's true. It depends on what plan you pick. You can pick a higher plan with high pay high high amount with zero copay.
Okay. So which of the following is not true?
C.
All right, let's go with C.
Coverage is unlimited.
All right.
Basic.
And that's correct. That's correct. Coverage is unlimited. Now we know that for basic surgical expense coverage is unlimited. Miss Karen, you want to read that explanation?
This is limited. The answer is unlimited.
Basic surgical expense coverage is commonly written in conjunction with hospital expense policies. These policies pay for the cost of surgeons' services, whether the surgery is performed in or out of the hospital. Coverage includes surgeons' fees, anesthesiologists, and the operating room. And the operating room when it is not covered as a miscellaneous medical item. As with the other types of basic medical expense coverage, there is no deductible, but the coverage is limited.
All right. So what we learned, a key point that we learned from there is that coverage is limited, you know. And that for basic surgical medical expense coverage includes surgeon's fees, anesthesiologists, the operating room, and so we just need to pay attention to those three: surgeon's fees, anesthesiologists, the operating room. So, okay. So let's submit and see. Oh, we
are low today.
Yes, that's okay. We learned a lot. We're a little bit underwater there, but we learned a lot. So
this is a very low ball test, and this is what catches people in exam.
Correct.
It's a very
Correct.
tricky.
Well, let's get into the next one. We said we're going to do at 3 of them, so we must do at least 2. Excuse me. Let me see if I can get back to where we were. All right. Let's go to the next one.
I'm not. Can you move that? Can you move this thing the other way? I'm not seeing the end of it.
Just a minute. We want to go to the next one. We want to go to the next chapter. Just a minute. Sometimes you got to manipulate this a little bit to get to the next one. So let me see. All right. So let's get to chapter 8, social insurance. Let's do social insurance. And let's hit the quiz there and learn from the quiz. Okay. I think we've already gone through the lecture of this. Again, those videos are out there. So you can, those videos contain the lectures on all of these chapters. So
are they online now?
Yes, they're online. They're on YouTube.
Okay.
Yes. If you want to give me your number, there's one. I'll forward them to you.
Okay, I'll do that now.
You want to read it to me so I can write it?
Go my number right now. We don't. Are we still taping?
Okay. Let me give you mine. Well, let me put mine in the chat, and then you can. Oh,
I got your number. Remember, I took it from Las Vegas.
Yes. I'll put my number in the licensing forum, and you can go ahead and text me yours.
Okay.
Yes. Yeah.
But what I'm saying is, I do have your number because I got it from Las Vegas.
All right, that's good. Yes, you did. So just go ahead and send me your number, and I'll forward you those videos. You know.
Send it by WhatsApp, right?
Yes, I will.
Okay.
Can you please forward it to me too, sir?
Okay. I think I have your number. I will. You know. Yep. So, all right. So, yeah, I think I can get your number, Ms. Ebukon, from the WFG Success Crusaders Forum. Yeah. All right. So, social insurance. Again, let's attack the questions and we'll learn. Miss Ebukon Nolova, can you go ahead and read this one?
Yes. Which of the following persons is not eligible for Medicare? A person age 70. B, a person who has turned age 65 and continues to work. C, a person who has end-stage renal disease. And D, a person who has been entitled to Social Security disability benefit for the last 6 months.
Okay.
We eliminate A.
I'm eliminating A and B because to qualify.
I'm thinking C.
The
fact that you have end-stage renal disease to qualify, you have to have a transplant. If you have a transplant, then you can get on Medicare. If having end-stage renal disease does not mean you're going to die or anything. But if you have a transplant, you definitely will get on Medicare because Medicare will pay for the transplant.
Okay.
Now,
Yeah,
I think it should be D, because this person who has been entitled to social disability benefits for the last 6 months, can we look at that?
I don't think
It's not D.
I don't
The
think it's
person who has been entitled to Social Security
entitled.
benefit for last 6 months. So this person already qualified for
Disability.
disability.
Because of
So
disability.
it's not.
Yeah. I think
will,
it's
will they qualify for Medicare if they qualify for Social Security disability?
I think so. For
Yes, but
disability.
they can. That's why you
Okay.
see some 24-year-olds that have Medicare.
Have Medicare, yes, because of disability.
It's not disability.
Okay. Because the disease that I knew that somebody would automatically have Social Security disability is kidney disease.
That's the renal thing they're
That's the
talking there
renal.
now. That's end-stage renal disease. But then you have to have a transplant.
No, I think that if they have kidney disease, they automatically qualify
It
for
qualifies
Medicare.
them. Yeah. So
But
that's
does it matter what stage?
I
it
think
says
it
end
matters.
stage, so
Yeah.
Says end stage.
chronic.
Stage.
So, but we know for sure it's between C and D. Which one do you guys want us to pick?
I'll go for C.
I'm confused now.
I'll
D
go
as
with
in David. D as in David.
all right.
Hold on.
Some people want D, some people go with. Let's go with D, and then
I don't want to see
we'll
it.
see. And that's correct.
Yeah, makes sense.
So what we have to remember is that, and I've seen this over and over, when a person qualifies for kidney disease, and you guys just taught me that kidney disease is also the same thing as end-stage renal disease. So if a person qualifies for that, then they also qualify for Medicare, and they qualify for Social Security disability. So, but D says a person who has been entitled to Social Security disability benefits for the last 6 months. What can you read the answer for us?
Yes, a person must have been entitled to Social Security benefit for 2 years to qualify for Medicare.
All right. So 2 years. They said 6 months. So the length of time is 2 years.
Okay.
All right. So good learning. Good learning. All right. Question 2 of 15. Olua Tosin, can you read this one?
Yeah. All of the following are covered by Part A of Medicare except physicians and surgeons services, B, home health services, C, inpatient hospital services, D, post-hospital nursing care.
Okay, they say except. So this is another one that we're dealing with, the except.
I think the answer is D.
D, post-hospital nursing care. I think so.
All right.
Oh my God.
Okay.
Oh God.
Yeah,
Physician and surgeon services.
That's
yeah,
true.
because B,
Part
C, and
B.
D sounds the same. Like home
That's
health,
Part B.
inpatient. Yeah, I
Oh
think that
God.
sounds the same.
That's Part B. Part C is a prescription or something.
Correct. Correct.
Whoa. I was trying to wrap my brain.
Which one is the number? I'm not seeing the answer.
You're not seeing the answer?
I think you should minimize the
rational
participation screen.
Yeah, can we make it a little smaller? It looks like what do you oh, I'm seeing. I thought it showed us what the answer was.
Oh
Okay.
yeah.
Oh.
All right. So let's go to the explanation.
Post-hospital nursing care, is that like nursing homes?
Which one is that?
Post-hospital nursing care. No, that's not
like
nursing homes.
rehab, like rehab. Something.
Yes.
No, but the rationale though talks about part, the response
part
is
A.
part B, but the question is A.
It says the
They say
surgeon is
except.
Look at the rationale for the answer. Go down, Nivali.
yeah, it says the
Surgeon
physician and surgeon
services
is under
cover
part
under
B.
Part B. Part C should cover
Under part
prescriptions
B.
and something.
Okay, they're under part B. Okay, not part A. Okay.
Yeah.
Okay.
Oh wow.
So they say Medicare Part A, also known as hospital insurance, covers the following: inpatient hospital care, skilled nursing facility care, home health care, hospice care.
Mhm.
I mean, so if they're in the hospital, don't doctors operate in the hospital?
Yeah, that post-hospital nursing care is hospice.
No, I mean, it's a physician and surgeon services. And I mean, don't those services take place in a hospital setting though?
Yeah,
They
but
say
Yeah,
inpatient hospital.
but it's covered under Part B, not under Part A.
Yeah, they say inpatient hospital care includes hospital stays, semi-private rooms, meals, nursing services, and medical supplies.
oh, okay.
Which one is that? Part.
That's Part A. That is inpatient hospital care under Part A.
Okay.
Yeah.
But not this physician. Okay.
So yeah. So again, we've learned that's why I chose for us to do these chapters, because they are tricky. It's better to rack our brains here than in the exam. So 3 of 15 here. My brain I just had a brain. Miss Lola, can you read this one for us?
I'm sorry. In reference to the standard Medicare supplement benefit plans, what does the term standard mean? A, coverage options and conditions comply with the law, but will vary from provider to provider. B, all plans must cover 100% of the Plan B deductible. C, coverage options and conditions are developed for average individuals. All providers must have the same coverage options and conditions for each plan.
Okay. What do we think?
Standard.
One way Medicare comes in, right? Any other supplements?
Okay, they say, what does standard mean? It's a coverage options and conditions comply with law, will vary from provider to provider. All plans cover 100% of Part B deductible. Coverage options are developed for average individuals. All providers will have the same coverage options and conditions for each plan. Which ones do we want to eliminate?
They don't cover 100% of Part B.
Okay.
B, do they cover all 100, must cover 100% of Part B deductions? Or is that true?
They pick up 20,
80.
20% is 80-20.
Yes,
All
80,
right.
20.
And the supplement picks up 20%, which makes it almost 100%.
Okay.
Yes, but it's not 100%. It doesn't cover 100%.
Of they say deductible, Part B deductible. So that's true. So think about it, if Part B picks up 80 and you're left with 20.
That's not 100%.
No, you're left no. They said the supplement picks up 100% of what is left of Part B, which is 20%, and you end up with zero copay. I don't know if I'm making sense.
Look at the question. look at the question. We're answering a different thing. Let's answer what the question is
Okay,
asking
so
us.
again,
Yes,
the
we
question.
are answering. This question is about Medicare supplement. Your supplement kicks in to pick up whatever is left from Part B. And if Part B picks up 80, the remaining 20% is picked up by your supplement. So the
Correct.
question says all plan must cover 100% of Part B deductible, not all of Part B.
Okay.
Standard. What does standard mean?
So I'm thinking standard remains something that should cut across.
Correct.
So it's looking like A for
Goes without saying standard.
yeah, like it should be same all over.
How about D? D is defining what you're saying, Ms. Ebukon Nolowa.
Okay.
Read
Same
D and C.
coverage option, yeah, and conditions for each plan. All providers will have the same coverage options and conditions for each plan.
Standard Medicare.
So which one do we want to go with?
Mm.
Better to rack our brains here than in the exam. Let's go with D and C.
Aha, okay.
It's D.
And that's correct. This one was a tricky one.
Yeah, they must have the same standard, the same coverage options.
Correct. All right. Whew. All right. The next one, Mr. Oluwatosin, are you there?
Set up for a medical prescription drug plan, individual must first be enrolled in.
The tone of your voice is very low.
To sign up for a medical prescription drug plan, individuals must first be enrolled in A, Medicare Part A, B, Medicare Part B and C, D, Medicare Part D, Medicare Part A and C.
Okay.
Wow, it's tricky too.
It's tricky, but the one must have to be Medicare first to be able to have them. But I'm tilting towards Medicare Part A and C. But the medication, the prescription is Part D, right? Is it Part D? I think it's Part D.
Yeah, I think Part D is
the medication itself is D.
Yes.
So that should be.
It's C that I really don't know what this is C is all about.
You know the supplement that we were talking about? Medigap or something.
Yeah. I'm tilting towards
A.
D.
Barrister, what do you think?
Yeah, I'm doing A and C.
I'll do
A and C.
Part C and C.
or even A.
Yeah, it must be already here.
Yeah.
All right, so which
answer? I think the answer should be D.
Part A and
I mean C for Part D.
But the
First,
situation
be enrolled
you
in
must
Medicare Part A.
Yeah,
I think A is the answer. Yeah.
First
Because not everybody has C.
Okay.
And B does not really cover for stuff in pharmacy except for diabetic supply.
Okay, look at the question. To sign up, to be eligible to sign up for prescription drug plan. So the person must have been in Part A first before that. Yeah, maybe the answer is either A or D.
I think.
So which one do we choose?
I choose A. C is the plan itself. So they're saying that to sign up for C, which is D, which one do you have to be in first? because D
Okay.
is the prescription plan itself.
Okay.
Yes.
So if that's the case, then I go with A.
I go with
A.
A.
Let's try A. If we fail it, we learn.
All right. So
I hate all this Medicaid stuff, man.
Is it resisting us?
it's resisting. It's resisting.
Sign that that's not right.
Okay.
Please signal that it's not right.
I don't know.
You want to make another choice before we go?
No.
And that was correct.
Correct.
Yes.
Yes. See,
Yeah.
where our reasoning, our rationale played out here. And I wish that I can have time in this exam to go through this rationale. Yeah, part C is the part C, number C is the part D, the prescription. But before you can get to apply for part D, you must be in Medicare part A.
Yeah.
So that is a wonderful rationale.
Yeah, and B does not really work in prescription except in hospital, like a hospital say. The only time you see a patient takes out their A and B card is when they have like diabetic supplies. Without that, you never see that. So it's A.
So again, let's drill it down that to receive Medicaid prescription drug benefits, beneficiaries must sign up with a plan offering this coverage in their area and must be enrolled in Medicaid Part A or in Parts A and B. That's interesting. Tricky, tricky, tricky. Let's go to the next one. So what type of care is not covered by Medicare? What type of care is not offered by Medicare? Hospital, long-term care, hospice, or respite?
Respite.
Respite.
Respite care.
Okay.
Respite.
And who knows what respite or respite care is?
That one they prepare you before you die.
Okay.
You
No,
get
that's
ready to
hospice.
die.
No, that's not respite.
That's hospice.
Temporal
Respite is
care.
giving the care provider a break.
A break,
Correct.
yeah. Temporal.
See, it's pronounced either respite or respite, depends on if you live on the east or west side of London.
Whatever.
Oh,
Oh my goodness.
It's long term.
okay. Yeah, I think we rushed too fast without reading through the answers. I think long-term care is the answer.
Really?
But now it's confusing because I'm just so lost.
Because earlier you read something like hospital stay, hospice care, right?
See,
So the good question is that who funds long-term care? Is that long-term care? Is it not like nursing home?
Yes, ma'am.
There's private pay. Who funds people that don't have money?
But in long-term care, though, we mostly have Medicaid patients. That's why they like them being there because they pay more.
that's
It's
Medicaid,
not
not
only
Medicare.
Medicaid
That's
that is there.
Medicaid.
They have
That's
Medicaid, they also
Medicaid,
have
Medicaid.
non-Medicaid.
Oh.
People in the rehab, they don't have.
Yeah. Folks, you know, we could have remembered this. We write that long-term care policy for people. Why do we write them? Probably because Medicare doesn't pay for it.
So you write
Mr.
them for people that have
Valentine,
money.
do I make a point there?
Yeah, you do. You do.
What? Go back
I
to
don't
that
get it.
explanation. Which includes
Respite care, which includes respite care and hospital care, are included in Medicare Part A.
But the question did not specify which Medicare. Was it A or B? He didn't say it. He just said
No,
Medicare.
just Medicare.
All right. So let's just master this. They say what type of care is not covered by Medicare. Let's just update ourselves that long-term care is not covered by Medicaid.
Okay.
Yep.
I
And that
was
is why
muted, I'm sorry.
maybe
was
that is
saying that-
why, maybe that's just a minute. That's why when you are past a certain age, say you're past 65, and you cannot afford long-term care, then Medicaid will kick in. But
Yes.
it's not covered by Medicare.
Yes.
Long-term care is not covered by Medicare, but Medicaid will kick in.
Yeah, for you to qualify, you have to be really poor. You don't have to own anything.
Correct. Otherwise,
Charlie,
It
claim
still
on
does not.
language. Sorry, go ahead.
otherwise they'll expect you to exhaust all your financial resources to take care of the long-term care before Medicaid, which is means tested, will kick in now to cover you.
Question.
Yes.
For long-term care, what if the question was Medicaid?
Medicare will cover long-term care
Medicaid?
for poor people.
That's
Yep.
why I don't want to be that poor.
All right. Let's go to the next one here. Miss Awe, if you are there, can you read this one?
Medicaid provide all of the following benefits except A, family planning service, B, home health care, C, eyeglasses, D, income assistance for work-related injury, except
I think
I
D,
know is the
work related.
Work
If
related
you're
injury.
working means you can't qualify for Medicare. You have
that's
yeah.
You're not working anymore.
You're
Yes.
not working.
I think we are on point there, but let's also read A, B, and C to look at the things that
family
Medicaid will pay for.
service.
So family planning services,
How
home
many
health
of
care services, eyeglasses.
How many of those in Medicare are still having children?
Well, Medicaid can be for people who are young.
This is Medicaid,
Oh,
not
okay,
Medicare. This is
okay,
Medicaid.
okay, got it. Got it. I was thinking about those on Medicare.
Correct.
Medicaid.
That's my confusion then. So when you talk about Medicaid, long-term, that applies to older folks?
Medicaid can also apply to older folks
Older
who
one
are
and the younger one.
above 62 or 65 and do not have the means.
Yeah, it's income
Income
based.
based.
It's
Okay.
income based,
Okay.
yes. Yes.
Okay.
So just remember that Medicaid is income based. It's for people who are below a certain means.
Okay.
All right. Next one. Miss Geraldine, you want to read this one for us?
Sure. Which of the following is incorrect concerning Medicaid? It is solely a federal administered program. False. The federal government provides about 56 cents for every Medicare dollar spent. We'll keep that on the side. It provides medical assistance to low-income people who cannot otherwise provide for themselves. To be true. It pays for hospital care, outpatient care, laboratory, and X-ray services. A is the answer.
It's
because
not a solely. It's not a solely federal administered
yes, it's
program.
funded
It's a
by the
state.
state and the federal. Yeah.
Yes.
Correct.
Hey.
So the key takeaway here is that Medicaid is a state managed. It's a state managed program, but funded by both the state and the federal government.
And the federal, yes.
Correct. But again, let's look at the things that are correct about Medicaid. B says the federal government provides about 56 cents for every Medicaid dollar spent. True. C says it provides medical assistance to low-income people who cannot otherwise provide for themselves. True.
Correct.
D says it pays for hospital care, outpatient care, laboratory, and X-ray services. True.
That's true.
We're right. Ms. Geraldine, can you read the explanation below?
Sure. Medicaid is assistance program for persons with insufficient income and or resources to pay for their health care. States administer the program that is financed by the federal and state funds.
Very correct. All right. Ms. Ebukun Nolowa, can you read this one?
Which of the following is not covered by Medicare? A, doctor bills. B, outpatient expenses. C, surgery. D, cosmetic surgery.
D.
What is cosmetic surgery?
This one is so clear.
No BBL.
To go change your nose and make your.
No tummy talk.
No tummy talk.
There goes my plan to go have cosmetic surgery. It's not gonna be
all right, brother.
All right. The cosmetic surgery is excluded from coverage by Medicare. All right.
Hold on. Well, what does all this? What do we call sex change operation? What is it called? Is it not cosmetic? They have been paying for it. Federal government has been paying for it with Obama and his boyfriend.
That's cosmetic, though.
That's cosmetic. But they've been paying for it.
Who has been paying for it?
The federal government has been paying for every man that wants to be a woman and every woman that has to be a
Where?
let's refocus into the class. We are
Are you just going?
Or maybe they're paying for the
It's all. It's something that you can prove.
Miss Geraldine,
because you already started by saying Obama and her boyfriend and his boyfriend. So right there,
Miss Geraldine, we are going into a minefield. Let's come back to class. We'll discuss that some other day. I promise you, anybody who makes it to Las Vegas, we're going to discuss this topic, but it will be in Las Vegas.
Exactly. We will have time to talk about it.
Yes.
Let us note that question down.
All
the
right.
information that Obama or whatever they pay for transgender is correct, but the information that his boyfriend, I disagree.
I said, let's come back to class. Let's come back to class.
You know, and it's not taken as cosmetic, it's taken as a social problem.
All right. Miss Lola, can you read this one for us?
How many pints of blood will be paid for by Medicare supplement cup benefits?
I think it's
A, everything after first 3. B is the first 3. C is none. Medicare pays for it all. And D is 1 pint.
No, first 3.
First 3.
I think it's first 3.
All right.
What a detailed, whatever.
Again, some people call it pins of blood. Some people call it pints of blood. It depends on
yes.
It depends on which side of London you live, north side or south side. That's right. Okay. Submit, and that's correct. That's correct. Ms. Lola, can you read the explanation?
Okay. Medicare supplemental policies cover cost of deductibles and co-insurance for Part A and B. Since Medicare will not pay for the first 3 pints of blood, a Medicare supplement plan will cover that. This is considered to be a core benefit.
Okay, that's good. All right. Desmond, you want to read this one?
In which Medicare supplement policy are the core benefits found? In which Medicare supplement policies are the core benefits found? A, plans A to D. B, all plans. C, A to B. D, Plan A only. Supplement policies are found. That what got me. Is it in A to D only?
A.
But B says all plans. Isn't A to D all?
Plan A. Supplement.
You're talking about Medicare core benefits, right?
Or core benefits.
Supplement policies. Oh, core benefits. Okay. That should be part A only, right?
Mm-hmm.
I'm not sure here. That's why I'm asking.
A and B.
I think it should be in all of in A to D, or all of them, all plans.
What's the difference between option A and B?
What is, but just hold on. What is Medicare? Is there any Medicare Part C?
Yes.
Yes.
Oh,
Yeah,
we're
Part
talking
C.
about Medicare now, not Medic.
Yeah,
not Medic. Medicaid.
I know. I mean
okay.
Medicare. They say Medicare Part C equals Medicare plus choice.
Thank you.
So they say in which core supplemental policies are the core benefits covered? They say Medicare core benefits are divided into A, B, and D.
So it should be A.
So Medicare Part C is also known as Medicare Advantage plan. So
A to D.
A private company. Okay.
I think I've seen that question. Maybe, I don't know why it says all plans. That threw me off the curve there.
Let's go with A to D. Because I'm reading here that the core benefits are found in A, B, and D. But it says Part C is Medicare plus choice. But there's no answer here that includes A, B, and D, except A to D.
-D.
So I'm confused, but the most answer that makes sense that includes Part B is A to D. So,
so let's see.
Let's choose and we'll learn. All plans.
All plans.
All plans. A to D. All plans.
Correct. All plans.
Difference between all plans and A to D.
All right.
Exactly.
Are there any other plans apart from A to D?
That's the point.
Yeah, the other plans.
Okay.
Yeah, but
Like,
A to D includes B.
when we start talking about Medigap now, then they start talking about, you know, yeah. So, but let's they say the benefits in Plan A are considered to be core benefits and must be included in other types. Therefore, all types contain the core benefits ordered by Plan A. Okay, let's go to 11 here. Des, can you read this one?
Okay. Regarding Medicare Select policies, what is restricted network provisions? Regarding Medicare Select policies, what are restricted network provisions? A, they determine who can be insured. B, they condition the payment of benefits. C, they determine premium rates. D, they help avoid adverse selection.
Which ones do we want to eliminate here?
The avoider. How does D sound?
They
is
avoid
there adverse selection in Medicare?
Selection. I don't think their purpose is to avoid adverse selection.
Okay.
And they're talking about what are the restricted network provisions. So they are talking about the provisions within the network that are restrictive. Which of these sound like provisions that are restrictive within a network?
I don't know.
I think we eliminate A and we eliminate D.
B. Yes, A and C.
Let's look at B and C. B says they condition the payment of benefits. That is restrictive because they can say if you belong to this network, this is how much you pay. If you go out of network, this is how much your cost is going to be. So that is a restrictive condition.
Yes.
C says they determine premium rates. Well, they can also say if you select these plans within this network, these are going to be your premiums as opposed to that other as opposed to this plan in a different network is going to affect your premiums as well. So between B and D, which one do we think speaks more to being a restrictive condition? This class is so sweet that somebody is taking a nap.
Did you say
somebody
D?
has been at work all day?
Very true. So between B and C, which one do we think is the answer?
Let's go with C.
Okay. They determine premiums rate. Let's see. All right. So we came close. We knew that it was definitely between B and C. They condition the payment of benefits or they determine the premium rates. The condition of the payment of benefits just means depending on which network you are in and what provisions in that network apply, those are going to determine how much of benefits you get paid.
So what's the answer?
The answer is B. They condition the payment of benefits. Okay. Desmond, can you read the explanation below?
A Medicare Select policy is a Medicare supplement policy that contains restricted network provisions. Provisions that condition the payment of benefits in whole or in part on the use of network providers.
All
Is
right.
that correct?
Correct, yeah. Question 12 here. Ms. Abongwi, you want to read this one for us?
Wait, baby, wait. Which of the following must be present in all Medicare supplement plans? Plan A, Plan C, co-insurance, foreign travel provisions, or outpatient drugs?
Okay.
Plan A.
Plan A.
Okay. First of all, what are Medicare supplement plans? What are Medicare supplement plans? Let me read what it says. Medicare supplement plans, also known as Medigap, are sold by private insurance companies to cover gaps in original Medicare Part A and Part B, like deductibles, co-payments, co-insurance. Medigap do not replace your original Medicare, but work alongside. Now, the question says, which of the following must be present in Medicare supplement plans? Again, let's go back. They cover things like deductibles, co-payments, co-insurance. So which of the following must be present?
Part C, B, because
I think that is the closest answer we have to this explanation. Let's see if it's right. Oh, man.
Is that Part C?
They say Plan A. Which of the following must be included in Medicare supplement plans? Man, this is...
these questions...
So, Mr. Bangwe, if you're available, can you read the explanation? Mr. Bangwe might be busy with that beautiful baby. Des, can you read the explanation?
In order to standardize the coverage provided under Medicare supplement policy. The NA,
I see.
what is that? Okay, NA developed standard Medicare supplement benefit plans, which are identified with the letter through N. That I assume that is A through N. Okay.
Correct.
The benefits in Plan A are considered to be core benefits and must be included in the other types.
Correct.
I'm guessing there because our pictures covered the end of my computer that I can't see clearly.
You just need to move it. Desmond, you have to move it.
No, it doesn't allow me. My mouse can't drag it.
No, you have to highlight. You have to use your left button to highlight it and then move. It's something that is very local to your computer. Only you can move it. If you scroll your mouse, click on the top of that.
Okay, that is better now.
There you go.
Completely eliminated that because that's why I'm reading like I'm asking you guys questions. It's like I know all I have is mental distance I can see.
Correct.
Okay,
correct.
Better.
You do not have any presumptive disabilities, Desmond. Let's just say that.
My brother, it is well. God has brought your brother this far.
Amen.
This past 40 something years.
Amen.
Since,
Amen.
Since
so
yes.
So it says
they wanted to kill me.
Standardize the coverage provided under the Medicare supplement policies. The NAIC, and this is the National Association of Insurance Commissioners, has developed standard Medicare supplement benefit plans which are identified with the letters A through N. The benefits in Plan A are considered to be core benefits and must be included in other types. So let's remember this. The benefits in Plan A are considered to be core benefits and must be included in other types.
You know, we were asking the question, what was all other types of Medicare? They have A through N. So
Correct.
all types. When
Correct.
you hear all types, it's not only A to D.
It's A through N, correct. All right. So Ms. Ebukun Nolowa, can you read this one, 13 of 15?
Yeah. Social Security disability definition includes all of the following except A, disability expected to last for at least 6 months. B, the inability to engage in any gainful work. C, a physical impairment expected to result in death. D, disability resulting from a medically determinable mental impairment. I think it's between A and C for me.
All right. I think you're in the right neighborhood, Ms. Ebukun Nolowa. I think you're in the right neighborhood. But we saw something earlier that points to the answer in this question. We saw something earlier. And that's something had to do with how long the disability is expected to last.
2 years.
Yeah.
Correct.
For you
Correct.
to qualify for Medicare.
For Social Security disability.
Social Security disability definition.
Yes. The disability expected to last 2 years.
Yeah. Okay. So A will be the.
Let's go with that and see if we're right. And that's correct. That's correct. Ms. Ebukun Nolowa, you want to read that explanation below?
Yes. For the purpose of obtaining benefits, the Social Security Act defines disability as inability to engage in any gainful employment due to a medically determinable physical or mental impairment that is expected to result in death or last for a continuous period of 12 months.
Let's go up a little bit. There was something there that could have created a confusion for me.
Okay.
The one that says inability to engage in any gainful employment, gainful work.
That's true.
Yeah, that's true, which means you have a disability that you cannot
Don't
engage
work.
in any gainful work. You cannot work.
Because remember, the
That-
question says except.
Except.
Okay,
Yes.
Except.
that's good.
Yep.
Cool. Thank you.
You're welcome. Let's go to the next question. We have Pat on. Pat, we want to bring you in. You've been a little silent. Pat, if you're available, can you read this one for us? All right, Pat.
Okay, we can move on.
All right.
Go ahead and read, right?
Yeah, go ahead and read.
An applicant is discussing his option for Medicare supplement coverage with his agent. The applicant is 65 years old and has just enrolled in Medicare Part A and B. What is the insurance company's obligation to do? A, to offer the supplement policy as a guaranteed issued basis. A, look at the applicant's medical history to decide what premiums to be charged. C, exclude pre-existing condition from from coverage under the supplement policies. D, send the applicant to a doctor for a physical. Nothing can happen until they get the result. Interesting.
All right, so I do not know what or what to use as the basis for trying to arrive at an answer here. But what I know is that most health insurance programs that we have ongoing revolve in some way or fashion around the tenets within the Affordable Health Care Act. Most health insurance programs that deal with either the old or the vulnerable revolve around the tenets in the Affordable Health Care Act, otherwise called Obamacare.
Yes.
And there's an answer here that borrows from the Affordable Health Care Act.
Is that C?
C.
I'm thinking it's C.
Correct.
Because
Exclude pre-existing conditions from coverage under the supplement policies.
Yeah, because it cannot be A because not everybody is guaranteed to have it.
Correct.
They actually make payments. You know, it's not like a free thing because it was a free thing, everybody will have it.
All right. So
this is why when I get to this exam, I will wonder what Mr. Valentine would think. And I will wonder, I'm not seeing everybody's name. I know Tina is gone. I know Vivian is gone. I will put my thinking cap to see what they will think.
all right. Let's see if your thinking cap will be validated in this case. So, you've put me on the hot seat now. Oh, and we went sideways a little bit. So it's a offer the supplement policy on a guaranteed issue basis.
Guaranteed.
Yeah. So Des, can you read that explanation?
Once a person becomes eligible for Medicare supplement plans, and during the open enrollment period, coverage must be offered on a guaranteed issues basis. What are we guaranteeing here?
So we are guaranteed that they will have coverage and their coverage will not be taken away.
Irrespective of the
supplement.
Yeah.
Irrespective of the pre-existing condition, right?
Correct.
Okay. Well done.
Yeah. So we are learning. It's kind of dicey, but we are learning. And that's why I wanted us to do these specific chapters, because they are tricky and they are the ones that can ambush you in the exam and determine if you score a 78 or if you score a 66.
Wow.
Yes.
I'm done.
Anything above 70 is a pass. And they can trip you on that borderline. So question 15 here. Oluwatosin, you want to conclude this one for us?
Okay, sure. A 63-year-old man is planning to be employed until age 68. When will he be eligible for Medicare? A, age 70 if he's still employed. B, age 69 and a half if no longer employed. C, age 65 regardless of his employment status. D, as soon as he retires at age 68.
This one is a low-lying fruit. You see this one,
Yeah,
you
should be
harvest the answer
65
and
C.
run.
65.
See,
65.
Correct.
65.
Age 65, regardless. You can submit, and that's correct. You want to read the explanation, Mr. Oluwatosin?
The individual will still be eligible for Medicare at 65, but if he is still insured under his employer's group health plan, the group plan will be his primary coverage and Medicare will be the secondary coverage.
That is good. That is good. So it's 10:18. We've learned a lot. I've been very proud of what we've done. You know, I think that there have been a lot of lessons in these 2 chapters that can help us cross that finish line in the exams. You know, so when we come on Sunday, I might have a class again before Sunday, just for us to be able to handle the next chapter that I wanted to handle, and then do some more past questions. So if I do, I'll put it in the forum way ahead of time so that people can see it and attend. Those who wanted to send me their phone number so that I can send them those recordings, please go ahead and do that. I learned that Vivian really listened to those lectures before the exam and she went and passed it. So those lectures really do help. But thank you all for your participation. Thank you for your commitment. A lot of people are waiting for you to help them. Yeah.
We are grateful, Mr. Valentine, for
thank you.
all the effort you put into make us exam ready.
You're
May
welcome.
the Lord himself reward you abundantly.
Amen. Amen. Thank you. Thank you. Well,
we sent the videos, the YouTube stuff back on the page, on the group page.
Is this lesson recorded?
Yes, this lesson is recorded, and I'll go ahead and